Dr. Rebecca is asking, what do you prescribe if your patient is allergic to penicillin?
So if they're allergic to penicillin, it's not a big issue. I usually prescribe clindamycin, 150 milligrams, take 4 times a day for 10 days, 2-3 days before until finish. That's all. I love the augmentin because it's great. The ENTs use it, but if the patient is allergic, we're going to go with the alternative.
Awesome. Dr. Coy is asking, what's your opinion on the Hammerless sinus kits, like the balloon, the no hammers?
I like him. I like them all. Guys, don't get hung up on the technology. Technology is important. I'm a big fan of technology. I'm going to share my technologies that I'm using in my practice this Saturday. I'm going to share with you tools, instruments, setup, piezo, all the machines that I have in my practice. I'm going to give you a review and show you how to use them, but don't get hung up on it. My recommendation to you, don't start the hammerless techniques before you know how to use a hammer. Okay, that it kind of comes later. I know that some educators don't agree with me, and I'm okay with that. I feel like stick to the basics. Stick to osteotome. I just showed you the blueprint for that. I showed you that these cases can be successful with the proper case selection, with the proper caution. And if you then decide to move to hammerless, densa, balloon, it's all a variation on the theme. Remember, the goal of sinus lifting is not hammerless or no hammerless or using that technology or another. The goal of sinus lifting is to find the least invasive way to lift your membrane, put some bone graft underneath, create additional volume of bone. That's all. If a hammer works better for you, use the hammer. I've been using a hammer for 25 years, and I'm pretty light on the hand, and I have a good sense, and you can develop that as well. You feel like denser burrs, balloons, there's other techniques, Rashad, that you use. Maybe you can share your experience. They all work. It's all about case selection and being very cautious.
Yes, it's all about case selection. Learn the basics. Learn a predictable way. Here's what I learned, Ziv. Before mentorship with you, you go out, you listen to different lecturers, you're on social media. There's 1,000,001 ways to do something. However, we need a baseline. We need to start somewhere. So what worked well for me, I took Ziv and like a monkey, I copied what he does. I copied it. I did it repeatedly over and over again till I felt I had confidence in it. And then, you know what? I have my own mind. I started developing even my own techniques and trying out different techniques. But at least I have a solid way that's predictable, that a periodontist uses, who is well known and that has great results and has a great reputation and is well trusted. Because ultimately, why are we scared? We're scared because we're general dentists trying to do implant surgery, and everyone has told us, don't do that because you're not a specialist. Well, general dentists invented implants. So if you know the ways, if you know the techniques, predictable techniques, then why not? But you got to start somewhere. But I feel, Ziv, as dentists, we are, I speak for myself, I love technology. I love trying out different things. It's fun. And I appreciate the doctors asking this because they're coming from a place of they're excited about different tools and techniques.